Here we go. Okay, so this at the end of March, we're going to have all the caucus positions reopened again. So if you're a first-year student or a part-time and you're interested in doing a leadership role for next year, email myself right here, jvales@USC, or LA, for an application and a list of the positions. And also, if you have any questions, anyone in a red shirt can answer. They're a board member, and they can answer any questions that you may have about different roles within the caucus.
So I just wanted to quickly thank those who came to the YPI workshop that happened 2 weeks ago. It was such a great turnout. Just to remind everyone that our second workshop will be this Friday at 4:30 VKC 158. And if you're still interested in volunteering, you can contact me after or email me.
Okay, so I'm not wearing a red shirt.
A version of red.
I'm a community rep for the caucus, and basically we're having a mental health workshop, destigmatizing mental health in Cadeza's Day Labor Center. And this is an opportunity for us to present a topic in Spanish. So if you're interested in presenting with us, please let me know. Our next meeting is going to be on March 24th from 8 to 9 a.m. And No Mas, this is our annual event. So No Mas is basically a forum where we're talking about a social issue. What we're going to be talking about is decriminalizing immigration. So talking about how it's not just a Latino or Latina issue, and destigmatizing the word illegal, for instance. So this is going to be a forum. It's going to happen on Tuesday, April 14th from 11 to 12:45, and we're going to have a huge marketing campaign. We're going to make a video, etc. So just look out for that.
Okay, so we're also accepting orders for our stashes. So the pre-order is $50 cash credit check, and all the proceeds from the stashes will go to our Noche. And there's a form online, so if you go on our Facebook, or if you don't have it, you can always email us or contact one of us, and you can submit.
Okay, and then, so every year we have this event called Noche de la Familia, and really it's an event for people that are graduating, but it's really an event to celebrate family and how they've helped us in our accomplishment of graduating. This year it's going to be on May 9th at Sheridan and Cerritos. The tickets are going to go on sale this Friday, and there's going to be a link on the website that'll take you to a PayPal or a way to buy a ticket. Or else you can come to the courtyard, and we'll be selling them for the next 2 months. The tickets are $35 per person, and there's free parking at the hotel, so if you want to invite a lot of family, more than welcome. That's what it's for. Generally speaking, we have it's like a 3-course meal. We have the DJ, there's going to be some form of live entertainment, a photo booth, and then there's a really special like stashing ceremony. And so what happens is Professor Angulo.
Everyone cries.
Yeah. Professor Angulo leads a time where your family can kind of honor you in graduating, but they like put the sash around you, and it's a really nice time just for your whole family to come together and celebrate. And also this year will be the first year that we're actually going to recognize 2 students from the School of Social Work that have made a really significant contribution to the social work school. There'll be more information on how to, we're going to have like an application for the award, but we'll give 2 awards away at the Noche event this year as well. So. And then if you're, go ahead, Chris.
Oh yeah, no, and that's our information, and if you have any other questions or comments, let us know.
Cool. Well, thank you all for coming, and then the reason why we're here is because it's getting near that time, near the end of the year. Either we're going in second year, or some of us will be graduating. And so I invited 3 people that I know pretty well to just kind of share about their experience in the field so far. They're alumni. We also have a couple other alumni here that have graduated from the program who have experience in the field. So I have some questions for them to start off, but the time is really for you.
It's a hot seat. I'm just kidding.
Yeah, if you have anything that you want to ask, feel free. But first, I would just ask if each one of you would introduce yourself, the agency that you work at, and just the role that you have within that agency.
And maybe like if you would like to share graduation year or concentration or concentration like that you graduated with. If you like.
I'll start. I'll hit it right away. My name is Bill Mejia. I'm the manager of social work at Huntington Hospital. I also manage the palliative care program and spiritual care. And I graduated from here in 1995. So I'm the senior person here. And my concentration back then was industrial social work. So I think it's work and family now, and I understand they're going to get rid of all that. But I never did any of that when I graduated, so so that was interesting. And I was part of the Latino caucus back then, which was much smaller. So now I participate. I'm in the LACAC, the Alumni Advisory Board, or whatever it's called. I'm a part of that.
I'm Linda Contreras. I'm a foster care social worker for a foster family agency in West Covina. I graduated last year. My concentration was in families and children, and I was in the Latino Caucus Board last year as well.
Hi everybody, my name is Argelis Ortiz, and I work at Children's Institute, Inc. It's a nonprofit child welfare / mental health / early childhood. I'm a regional director of community services, so I do all the fun stuff. The arts and the youth stuff and the non-clinical things at COI. I graduated in 2010. My concentration was COPA then, and one of 6 or 7 members of the Men in Social Work interest group, or the Neiman Caucus then. So, yeah, we kicked it off and they passed it on because it's a lot of work.
Does anybody have any questions to start off with?
Salary?
Well,
Maybe. But,
can I have a show of hands of just who's second year student? Or wait a minute, who's first or second? What is it called? Foundation year, yeah. Who's that? Okay, good. And then who's graduating?
Woo!
Oh, all right. Oh, this is a nice mix.
I guess my first question, would just be, can you talk about the career path you took when you first graduated and how that helped you kind of get where you guys are at today? And just kind of explain that process a little bit.
I'll start. Since I just graduated last year, I didn't know what I wanted to do. Like which population, and I went with the one client that made an impact in me and was a teen mom. She was 18, 2 children, foster child. She met every statistic you read in your articles about foster child. So I'm like, let me direct to foster family agencies. I didn't really know about FFAs, but you start meeting people in the community and tell you what FFAs are and what they do. And today I come to realization that that was a perfect path for me, because an FFA social worker, it really builds your foundation for social work. It's not just focused on one service. You're a case manager, so you deal with wraparound, you deal with clinicians, you deal with school administration, you deal with TBS workers. You're the case manager for that foster youth. So I learned myself about those different things. Now I can go back and say, oh, maybe I like that MAT assessor, or I like that clinician. It just built a foundation of what I really like. And I came straight from high school, straight to undergrad, straight to graduate school. So it's, I know some of us are like that. We go straight, and it's like, where path do I want to take? So it's been about a year, maybe almost, and I feel like I built my foundation, and I know where I want to direct to more in the future.
What is FFA?
Foster Family Agency. They're contracted by DCFS, and you recruit foster parents. So we're contracted by DCFS, and the kids are placed in FFAs. There's a lot of FFAs in the community.
Sure. So I've been working at CI for almost 10 plus years. I've been on the payroll since then, and ever since I started as a case manager and that sort of gang prevention stuff, I knew that I like working with the youth, I like working with the families, but what I'm really passionate about is managing people and managing programs, and that's kind of what has been my goal since. So, there's only so much you could do with your BA in that sort of nonprofit social work level, and I had to come back to school and get my master's, but I had to do it part-time. I couldn't afford to do, let everything go and do the family thing as well. But I always knew my ultimate goal was to manage and run and facilitate and that sort of macro type stuff. So I had under my belt a lot of clinical or that type of experience. And I really wanted to just come straight to a program that was going to give me those skill sets and give me those benefits once I left. So while I was at school, I was still having my hand at CII and other nonprofits with the internships and stuff, but I always managed to work my way into doing some sort of development work or doing some sort of, not grant writing, but like research. What else did I sort of do? A lot of stuff like that. Put me with partnerships to do stuff in a macro sense. And that's what I love doing. I love thinking bigger. I love connecting the dots for folks. And it's been a roller coaster because there's not that many of us out there. It's more of like you're either a 100% clinician or you are a MBA person who does these type of things. So I like to butt heads a lot with my counterparts in the other departments. But ultimately, leadership and working in a management position has always been my thing. So along with what I've done at work, I've done like some outside, not consulting, but some outside work in working on my leadership skills. Because what I like to make sure that I could hang as a MSW or as a graduate student with other fields. So with an MBA person, with a person with an MPH, or just JD. So that I have to make sure that my skill set is as good and transferable to any other job I could get. Be it a school setting, be it at a hospital, be it wherever I be. I want to make sure that I can hang with other leaders and so on. So that's been my trajectory, and hopefully not stopping yet.
Stay competitive.
Yeah. Always.
Well, when I was here at USC, my goal was to be a clinician. I mean, that was my aspiration, and I ended up working a lot in end of life. So, way back in the early '90s, many of you were not here, but the AIDS epidemic was growing, and I was a big part of education. I was actually working for Xerox after college, and but on my part-time I was doing this education about HIV prevention and doing groups and facilitating discussions, and I didn't realize that I was doing social work at the time until somebody pointed it out to me. So I left my career at Xerox and then left my MBA degree and started here at USC, and so I was very passionate about working in end of life. It just led from one thing to another, from inpatient hospice to home hospice to palliative care. And then what happened is I was doing some per diem work at Good Samaritan Hospital, just to get, I know a lot of graduates like doing that, just to get experience in other areas. And that led to a connection at the hospital I'm at now, Huntington, where I helped develop a palliative care program. And then a couple years later, there was a position open for management. Excuse me. So my goal at the time wasn't, when I came here, was not to be in management, but it kind of turned out that way. As the years went on, and I guess it's good to have an older perspective, because there comes a time, especially if you're working so intensely with a population like death and dying, that you're like, maybe I could do something else after 20 years, And working with employees is very much a social work function. I develop their skills, I tap into their resources, what they're good at, I try to develop them. I am the best disciplinarian. I hear it from a lot of people like, I know I'm in trouble, and I know I just got in trouble for you, but it feels like I didn't, and I want to do better. And I was thinking, God, managers just need social work training. Leaders just need to have that part of them. So that's where I am now. And actually, 2 years ago, I started an additional degree at Cal State LA in a master's in healthcare management. So for the same reason, just to keep up with the others, a lot of times in a healthcare setting, they regard an MSW like an RN. It's a professional degree, and it gets you to where you are. But oftentimes an additional degree will kind of just bump you up a little bit to show that you have other skills. So I'm back in school, and it's very interesting. I graduated in June. So anyway, that's my story.
Lauren, I think Lauren.
I wanted to learn more about palliative palliative care? What do you do in that? I know it's at end of life, but what do you do?
So it's working with families. It's in an inpatient setting. So if you ever hear about a situation where, you know, the family gets the word from the doctor, like, there's nothing more we can do, here are your options, that would be the palliative care team, the social worker, together. So they basically break the bad news, but it's not always end of life. It's just like, so we understand you have stage 1 or stage 2 cancer, we can help you through this journey. So it's just helping them along through that projection or whatever of terminal condition or serious condition. But we refer on to hospice. We don't take that on.
What made you decide to choose that route once you graduated, going into?
Well, so I was working for Xerox, and so I thought, well, I'm going to come back to Xerox and work with their EAP program. Way back, large companies had their own EAP programs for counseling. So that was my goal, but, you know, having worked a little bit in HIV when I graduated, there were so many opportunities in LA to work in HIV and AIDS. So I took that route and was very passionate about it, and it just kind of led to hospice. And hospice was like, well, this is great. I'm working with older people, not young people who are dying. It's a whole different population, and it just snowballed from there. You just never know, you know.
I'm curious if any of you have attained licensure, and if so, how has that affected your job where you are now?
Sorry, no, I purposely did not go after licensure. I know it's a lot of goal for folks who get the MSW, and it's not always been my goal, as I mentioned earlier, about management. And although it's counterintuitive to be at a management level that has to, you know, have clinical supervisees and be in a mental health facility place, so I get that as well. My supervisor tells me all the time, but I purposely have a different path. So I'm sticking it out as long as I can, but I like to, you know, pursue the doctoral stuff after. That's really my ultimate passion. Like you said, I'm hopefully going to get in hopefully soon, but if it doesn't happen this year, it'll happen next year, but it'll happen. But I don't want to emphasize 2 years plus of my life in doing clinical work when I know that's not my path. And I'm okay at it, I want to say. But I like it, and it actually intrigues me, but it's not something I see myself doing 40 plus hours. Like I mentioned, I did that in Wraparound, I did that as an intern, I've done that, and I know what it takes to do, but I also know myself, and I also know that I don't leave it at the door, and I don't, I take it home with me, so I purposely wanted to do something that I could encourage and support others to do it, but not something that I like to do. Now, it does hinder on me moving up, because license does give me the opportunity to go to the next step, does give me the opportunity to take on the next managerial position, at least where I'm at. But I'm aware of it, and I'm not naive about it, and I know it's keeping me at a cap where like I'm not going to go past it until I get the licensure, but I'm not ignoring it either.
He made a point where I'm not licensed yet, I just graduated last year, that mentally I want to get my license to be at that management level, to make that license salary.
Yeah.
But I went through a period where I was like, I don't need it, because I got promoted really quickly at my agency. I was already a supervisor. I was already making that salary, and I'm like, I'm set. Like, I don't need that. I don't need it those 2 years. But long story short, I left that position last week. So now my goal is I'm going to go back to that goal. So what I'm doing now, my agency does not offer hours, but they do have, my supervisors do have connections where they can, hook me up with someone to get me hours. But what I'm doing at the moment is Friday I just went to a seeking safety training. I'm doing a trauma-focused training online. I'm looking up classes. While I have time now, I'm doing all those other little requirements. I'm building up my resume for when I do get a clinician position, because they do look for evidence-based practices. You need that experience. Not many agencies offer that training. If you have it on your resume already, they're saving money, they're saving training time. So right now, I'm not building up hours. I do have my BBS number. It's just sitting there, but I'm building up my resume to get that clinician position.
I do want to jump. I did strategically apply for the BPS and all that stuff because a lot of jobs require it right away.
Yeah.
But then once I got in, or once I'm in, then I opted to do part-time counseling. So I do a few hours here and there. So, you know, but again, if I do a few hours here and there, it's going to take me 8 years to ever get my hours. So I know that's not the time.
I did mine right away. I just got it out of the way. I was lucky though. I worked for a mental health agency right out of MSW. So I was able to accrue hours quickly, and it was just 40 hours a week. It wasn't broken down. So within 3 years, I was able to get licensed. I kind of knew that if I waited any longer, I wouldn't do it. So I was one of those who just get it out of the way, whether I need it or not, you know, just to get it done. So I'm glad I did. It was easier back then than it is now. But we did have a panel interviewing us. I was part of that crew. I got to have a panel, which I preferred over the exam. But if you do get into the healthcare setting, it is something that is required. I do have some social workers who are capped because they're at an MSW level, and they can't go any higher as far as salary until they get that licensure. So once they get that, I can put them into a different salary, and then they can move higher. On the other hand, the director of our outpatient senior care network program is an MSW, and she never got her license. And she's a director, so she's like, I don't need it. If I need anything, I'll call you. So it works, you know.
It's either you work hard or you hire smart, you know. So if you get to a position where you get to hire folks, then you hire your team around you. But, you know,
My supervisors are not licensed, so it's possible to get up there, but again, there's that salary cap that gives the agency a reason to pay you less.
yeah, exactly.
I have a question. Can you all describe what was your biggest challenge so far in the field, or what has been your biggest challenge? Yeah, and describe kind of how you handled that. And then I have a follow-up question if anybody else doesn't have a question.
Okay, I'm gonna be honest with all of you, okay? One of my biggest challenges in this field is the reality of social work. I feel I came into this field because there's this fantasy. I really want to work with teenagers and youth. I think I'm going to make a difference. I'm going to do this. You're going to do this big old fantasy thing, and then my population is foster youth. And then you get to really learn the system and the macro and the business side to it. And it made me even, I had a period where I was questioning my career. I don't think I can do social work. I can't do this. I can't. The systems, the business side to it it got me really angry, And luckily I have colleagues that I can talk to and vent to about this. And how did I overcome that is just taking a step back and really thinking, is this what I want to do? Really reflecting that self-awareness, saying, why am I here now? Why am I in this position? There's a reason why I'm here. And I'm still currently going through that reflection. You know, I'm still in this field. I'm still dealing with the system. I'm still dealing with the business side at that macro level. And it's just something that I'm struggling still right now, and I'm doing a lot of reflecting. It's only been 10 months in the field, and I'm still doing all reflecting. It's been a challenge. It's this fantasy I thought that I was going to change the world, change the youth, and you realize there's a lot of obstacles, boundaries stopping you because there is a business side to nonprofits.
Yes. That's interesting that you say that, because I'm always encouraging. You know, it's when you're on the other side and you're encouraging productivity and numbers, and it is much different. I just remember being in the field and patients dying when I first started out, and how difficult that was. But yeah, it was interesting. Like, oh my God, this is real. Or actually being with patients when they were actually dying. But I think to myself, I thought, wow, this is cool. I mean, I was upset and, you know, tearful afterwards, you know, with whoever, but it was a point of saying, wow, I'm really good at this, or this is something I really like to do, so I shall continue on. So it's probably the most difficult.
When you feel that it's real.
Yeah, like, ooh, we're not playing anymore. Yeah.
Can't just punch out.
No.
Dealing with interns is just the most difficult part for me.
No one in the room, right?
Just kidding.
Not you guys.
No, just, yeah. Typically. No, but for me, I don't know if it's a difficult, but it has been taxing on the family. So at a managerial position or something that you can't just cut off at 9 to 5, it is sort of, you know, it wears down your personal family life. So I always put that out because, you know, we all have different paths. We have a partner, we have kids, we have somebody to take care of the older. Whatever our family is, it's as important to recognize that in, you know, your peer and your subordinates or whatever. But that's been the difficult part, is that, you know, I don't come home and I talk about my day. Like, it's not that type of thing, and I don't expect her to understand what it means, like so-and-so just jumped off a ledge or something. Like, it's not something that is, you know, conversation while you eat dinner type of thing. And there's a lot of confidential stuff I just don't say, right? Like, I can't say that, or if I do start, you know, breaking down or something, it doesn't help to offload on somebody who's not ready for that type of stuff. And then when I do that with my peers, we check each other. We're like, oh, we're not at work anymore, dude. Let's not talk about that, or let's not, you know, let's do it during work hours. Let's do it at a sport thing. But it's a lifelong thing, I want to say, because even, you know, at the higher, been there 20 plus years, there's still bigger things you deal with, right? Like we just about a year ago, this is my first time doing it, but we went on our first round of layoffs, and you know, I had to literally, you know, look into my team and see how we can mix stuff around, and you know, that was my first thing. But that didn't keep me up as much as knowing that the person I was about to lay off or whatever had to deal with their own journey, and you know, that was difficult as well. So knowing that your input has actual value in somebody else's entire career or life, I mean, you know, that does keep you up. And your family.
Specifically for you. I know you mentioned before that you've gone back to get degrees, and you guys graduated with another degree, so congratulations on that. I guess I had a two-fold question. What was the thought process you went through to go that, hey, I need to go back and do it? And what were resources or programs that you used to be able to do it? Because as everybody knows here, master's programs are not cheap at all. Even if you do part-time, it's still like, universities are going to get their money. So how did you...
I have to say, at my age, at my point in the career, I didn't have to go back to school. I'm established at Huntington. I don't need to, I'm not in danger of losing my job. But I felt when you're social workers, you're trained like nurses. You're trained to be clinical. And I think that's the perception of people. It's like, well, you have your degree, you're licensed, so you have certain skills. I wanted to be able to go into an executive meeting at the hospital and be able to articulate things to them in a way that I wouldn't as a social worker, having worked on the floors. So that was a personal thing for me. And I remember about a year ago going to a conference, and I had to be in a meeting with project planners and big breakout groups. So it was project planners, doctors, other people in the palliative care area, and we were talking about our programs, and we were just talking at this high level that I was able to keep up with and throw out things that I actually learned at school, not at work. So to me, I was like, okay, I got my money's worth. You know, so it was more of a personal thing. I don't need, but there is that among my peers, like, oh, Bill got his master's in healthcare management, so they kind of look at me at a different level than a clinician who was just promoted to manager. So when you get out into the field, you may be in a setting where they help you with tuition. So Huntington Hospital, for example, paid for practically half of the education at Cal State LA. I wouldn't have done it any sooner. Of course, you know, you have all your loans from USC, so you would hate to start another one. So I waited until I was financially secure to be able to do it. They have a similar program here at USC, but I just didn't want to be straddled again with another huge loan. So that's why I chose Cal State LA.
Yeah. It's a good school. I went there as our first year as undergrad, so.
I like it. You know, it's interesting. My best experience was here, and I had all my, you know, Latino caucus friends, and we would go to the Sizzler, I don't know if it's there anymore or whatever, across the street. And I thought when I went back to Cal State LA that it would be different, but it's not. I still have a lot of friends that I met through the program, and we have lunch or dinner before class, study group, so it's fun.
Thank you.
I don't know, it might have changed for some of you who've been out there already for a while, but how long did it take after you graduated to get your first job after graduating? Or if you got it right away, I don't know.
Like I mentioned, I always had my hand at CI, so I've been there over 10 years, but I strategically never left because I knew there was always going to be something around there for me. But I always kept ties with my other internship programs, like the foster youth placement I had, what was another one? There was a COPA thing I did for another placement, but I always kept ties knowing that somebody was going to link me to something else. But my personal goal was not to leave SC without a job, post-master's job. So my first placement was at a HIV clinic at Watts, and they actually helped me while I applied, but I actually got a research job right after school. So, you know, I graduated Saturday, Friday, I started Monday, because I already knew, like, I already got to get going, there's bills to pay, and, you know, Hawaii wasn't already a thing, you know, but that sort of, I have a leadership plan, like I know what I kind of have to be going through, and it's good to get the credentials, it's good to get sort of different experiences, but there's nothing that holds the test of time but time, you know, like you could be in different placements and be the best, whatever, but you have to stay there for a while in order for people to know that you're proven, you know, like, so I did the research thing for a little while, and then that made my my now employer sort of want me back, you know, like, oh, I know you've been doing these several things, and we have this position available for you. And if I would have stayed, I want to say that I wouldn't be where I'm at now. I would have just been in a lump sum with a bunch of other clinicians, and, you know, so you strategically want to come in and out, and, you know, keep ties with folks, and be wanted back a little bit, and try different things, and just be open, or else, you know, the leadership plan continues, but I mean, if I'm not open to it, then I'm stuck, you know, job-wise.
I got hired about 2 weeks before graduation, and it was tough because, you know, I still had other interviews. I got accepted by Riverside County, I got accepted by another one, and it was hard. So I did get hired, and I chose to go to that agency. I don't know, something was just telling me to go there, and I did ask them, can I start a week after? Like, I just wanted a week off. So I got in right away, started right away.
For me, times were different back then. We only had 200 graduating from our class, and we only had UCLA and Long Beach, I think, as our competitors. So we all got our first choice of our placements, and a lot of people were hired right away after graduation. So I did want to say, for those of you, are you guys interviewing for your second year placements? Do you have to go on interviews then? Okay. So I did want to share with you the importance of the interview process, and how for us it's the most important thing that could happen to a student when they come in. Our placement is very competitive. We have like 40 students applying for 3 or 4 positions, and the likelihood of them being hired on to us is like 90%. So landing that first interview as a student is probably more important than anything you do after that. Because for me as a hiring manager, I have more investment in a student because I know their issues or whatever. I see them the whole year. I get feedback from the staff on how they're doing. So by the time they graduate, you know, I'll be able to say that's my first choice, second choice, you know, with all the feedback. So when you go to your interviews, dress professional. Ties for guys. You'll get old-fashioned people in your interviews like me, or other people who appreciate the days when people would dress up. A firm handshake, and just being carefree. We don't like to see social workers being so serious. We had one student who came from USC, and we had pictures because we had so many people. It was like sorority rush or fraternity rush. Sending us the picture. So and it was blonde hair and very young looking. I said, well, this will be a quick interview. And she came in, I know it sounds biased, but she came in and she just, there was 3 of us, and all of us were older social workers, you could say. And she just connected with all three of us. She was funny, she was witty, she was personable, and then she got serious and she was able to articulate. And so we think, how would this social worker be if she was with a patient, a difficult patient, or a cranky patient? So if she's at that young age able to connect with us, that made a big difference. She actually said that when she left that interview, she cried because she thought she did such a horrible job. But you know, and so we look at those students, not just what they have on their resume, but how you connect, your sense of humor, your ability to connect, and that may be your job right out of college. So already I'm figuring out who out of the four. I've got my list. So so that's very important. And please send a thank you card after your the old-fashioned. Emails are nice, but when you do a thank you card, it means a lot more to them. You know, especially if you get a social worker an older social worker who is set in old-fashioned values. So that's just my advice for all of you.
I wanted to point out the personality. My administrator who hired me said that's what stood out was my smile and being upbeat, outgoing. I wasn't just there serious Q&A. She's like, you were like a little fireball, and I like that about you. So don't let loose, let loose, and don't be so Q&A. And since we're I saw your hand up, but since we're speaking about jobs and things, I want to say, he touched it on too, is just networking, keeping those ties, because when I came into my agency, I was the first full-time social worker. It used to be contract workers. Next, I brought in a USC student. Then there was another USC student, another USC student, and right now I work with 2 other USC students. So, and now they just want to hire USC students. And I'm here, if you guys are looking for a job, we are hiring. And now my administrator is just like, Linda, bring in another one. Someone leaves, Linda, bring in another one. And if you guys had me on Facebook, I'm posting job. Now they only want USC people. So keep those connections you have.
I'm harder when we hire USC students because I've been through the program, so I know kind of what to expect. So I'm definitely like more nitpicky about stuff, and I quiz people on their Spanish, and I do the whole thing just because one of my pet peeves is that you claim something that you're not, and that's from my hood days. Like you claim something you're not, that irritates me. But it doesn't matter. Like if you put something on black and white, then be able to provide or at least a reference to it, or be able to do something about it. Because there's nothing worse than you say you're an EVP expert when you haven't even gone to the training, or maybe you could say I took a workshop, or maybe you could say my supervisor was inspired me to do X, Y, Z. But there's nothing that you say something on paper and you come out that's totally different. At CI, I've always said that it's a great learning institution. It's a great place to get your stripes. It's a great place to earn your keep type of thing. But if it's a lifelong commitment you want to do, it might or might not be the place for you, because it's really competitive. It's really it's like the Target or Walmart of out there. People know CI, they know what it brings, they know what it attracts, but it's also that hard to get in. And then once you're in, you have to keep it. It's not just I'm in now, and just like here, right? I'm in, and I'm going to coast it for 2 years. But it's work, and you got to follow up. But she goes next.
Yeah, what hospital was it you work at?
Huntington Hospital in Pasadena.
Oh, okay. They did tell us about the interview process, but I don't think they mentioned to us if it was doing, where you do the selection first and then you get called to do interviews. I don't know if they said that they were doing that. The pre-screening. I don't think they told us that we were doing it this year.
No, we're not doing pre-screening.
Oh.
We thought about it, but we realized that out of the 40 candidates that come to, they may be our future staff members. So we invest in interviewing every single person, and we interview students from other schools. So that's why it's important, because you're competing with other schools, and they're training their students to land their interviews and do well. So it's important that you guys do too.
Are you part of the interview committee?
No. It's if there's a good candidate, sometimes they'll bring them by and just say, hey, this so and so,
Yeah.
you know, kind of like just remember this because this might be one of them.
And I'm in the health concentration as I was interviewed for hospitals, and I just applied to do my master's in public health. I
Okay.
think getting the master's in public health would also kind of give you like a little boost to kind of increase that, or kind of remove that cap of the social stigma or whatever. Because I'm still debating also to get my licensure as well.
Okay.
Yeah.
You know, we had some MPH, MSW students as well. We had a law student, dual law, and I mean, we treat them like social workers when we hire them. But it's always good to have that extra. I mean, look, it took me years to go back and get another degree. I wish I would have done it back then. If that's what your if that's what your interest is. I mean, it took me a while to say, oh, maybe I'll get into management, you know. So, so yeah, if you could do it now, excuse me, certainly it always helps to have that.
How early is it appropriate to apply for job opportunities if you have a set start date? I don't know if I worded that
From
correctly.
like
After
like if you're-
graduating,
Yeah.
you know, I'm always trying to get ahead of
Yeah.
the game. I don't know if it'd be appropriate to start applying for positions now
Yeah.
if I have a specific start date that I'm looking at, only because I want that 1 week, 2 weeks
Yeah.
to just catch up on sleep.
Yeah. For us, I can speak for my agency, it all depends on what type of position you're going for. If it's a clinical position, most places, they want you to have your BBS number first. Why is that important? Because once you get that number, then you're able to bill on this side. And if you don't have that number, then ultimately you're not earning the agency the rate that we're supposed to be paying you for. So if you're looking for a clinical position, as soon as you get the degree, whatever, apply for the BBS so you can get that going. And then some places will hire you on as they wait for the number to come back. Other places like us, we won't even consider it until you get it. A couple of things happens that you might go for it, there's a lag time, all of a sudden that 2 months turn to half a year. That meant we've been paying your salary for half a year, you're not earning the rate that we're supposed to be paying you for. And we're pretty straightforward about it. There might be other positions like in the school or whatever that ask for the PBS. And the easy answer is check what you want to apply for and see if they require right away. If they don't require right away, yeah, there's no reason why not to apply. And then they might give you the heads up, like, we're really looking for somebody now. If this were to be 2 months from now, then we would hire you, but it's not going to work. Yeah. But most folks are pretty straightforward.
I started applying, I remember, early as February. I was on top of it. I was like, let me just do it now. And if I go to that interview and they say, we need someone now, I don't have my degree till June. Sometimes they wait it out. For example, if you guys interested in foster family agencies, I'm here, and my administrator said, we're willing to take them now. Maybe you won't get that salary yet, but when that degree post is, you'll be at that salary. And it varies. The way I thought about it is it'll be interview experience if, they couldn't take me now.
Yeah, they usually, most of my applicants wait, because then we post the position, and that's when I kind of know when they're going to graduate, so then I'll throw the position open then. Because if I open it now, I'd rather wait. So.
There's influxes, right? There's you guys graduating, a bunch of other schools graduating.
Yeah.
The U.S. is graduating, people relocate. But I just got an email this morning that LSWC is laying off a whole bunch of social workers, PPS. I mean, a bunch of people in the hundreds. So 600. So so that's 600 positions that are no longer there. Therefore, you're competing with those folks as well. So I mean, there's nothing to say. Why not start now? Put yourself up.
We have time for about 1 or 2 more questions. Anyone has anything?
Yes.
How likely is it in the hospital for, let's say I just graduated with maybe just the internship experience, the previous, the graduating year? How likely is it for someone to get hired? Because I've heard some people say that you need 3+ years of experience. Is that true for you?
Well, from a manager, I look at, there's different levels that you come in at. So if you come in with little experience, you're cheaper. So that might work. And I say that in a way that it's like, Well, you're giving this opportunity. Like if you have all these, if you have a good attitude and you're positive and you're a hard worker, at least from evidence that you've shown so far, I'd be willing to give it a try, because we can always train you. You can't train attitude, and you can't take bad attitude away. It's just a nightmare. So, so I'm always willing to give people a chance. But a lot of times, people will look at your experience in an acute setting. So if you've done your internship in any kind of hospital or nursing home or subacute or whatever, that at least gives us an idea that you've been exposed to it. A lot of the entry-level positions at Huntington are per diem, and they're in the emergency room. So we want to know that you've been exposed to blood, to trauma, to gross things, and that you can handle it, because that's a risk if you get down there and we're training you and you're like, I have to get out of here. So those things, you know, we want to show enough experience to show that you're exposed to it. In the acute setting, it's very important.
And I do have colleagues that got hired right away off intern. Kaiser, Children's, White Memorial. So there's a chance. Yeah.
Okay, thank you.
But we do pay well anyway, so
My question's for you, Mr. Romania. I'm in the health concentration. I'm graduating this year. I'm already looking into hospitals and to apply to positions. I'm wondering salary ranges of a bigger hospital such as Huntington and community hospitals, smaller hospitals. What are salary ranges that I should be expecting to see?
We just did a boost. We just adjusted our salaries. I'd say right out of college with no experience, your hourly rate would be anywhere from like $31 to $35 an hour. But that quickly changes. I think a lot of us are fearful when we hear a salary amount. But just know that when you get out there, it starts to really add up. As the years go on, you get more increases, or you moved into different positions, and the next thing you know, you're bumped up. So if you have 5 years of experience or more, it's sometimes like $38 an hour, 35 to 38, and then it just keeps going. So it's competitive. We compete with all the hospitals. We don't compete with Kaiser because they're crazy. They just can't afford to, you know, we're a community hospital. They have the support of all these other hospitals to kind of cushion their salaries, and we don't.
Same here. We hire about the same rate, but we don't compete with DMH. We don't compete with DPFS. Just it's a different monster, right? But we do compete with other nonprofits in our field. We do compete with other mental health, other HR places. It tends to be a couple pennies here, a couple pennies there, but besides the salary, I know that's really intriguing most of the time, but you want to see what availability is to move up. Because if you had, I don't know what community hospital you're thinking about, but if it's really so small that you could only go as far as assistant director of such and such until somebody passes, you know, then you're like, I'm never going to get out there, right? But if you go to a bigger place where there's various departments and, you know.
That's a good point. I just hired somebody last year who had like 4 years experience, and he said, I want your job.
Yeah.
And I'm not leaving, and there's no equivalent in this hospital. You're going to be in your position for a very long time, you know. So that's a good question to ask. And also benefits are something that we don't think about when you're students. But like Huntington, the trade-off is that we have the best benefits, vacations and medical. I mean, all these different perks that you get. So when you graduate and you get these, it's like, wow, I have all this. This is really, our benefits are better than most, than like UCLA and even Kaiser. Because you don't have to go to Kaiser.
I was Families and Children, so I was applying to little nonprofit agencies where the salary is not high at all. But I wasn't scared to ask that salary question. I was like, what are my chances? You know, when do you get a raise? I don't remember the way I phrased it, but I already asked, you know, it's a nonprofit. Yeah. And I remember my supervisor kind of chuckling, like, nonprofit, you'll be lucky if you get one in a year. And I was like, oh, you know, that was downer. But I still went for that position. And within 6 months, I got a pretty good raise, like more than I'd expect. I thought like 1,000 more or 2, 3. It was more. And there was an opportunity for advancement. I took it, and it like doubled, and So there's still opportunities out there, but for little nonprofits, it's a little on the lower end. But there's room for advancement, and ask those questions right away. Because if there's no room for advancement, they might cap your salary like that's it.
We just have time for, if you have to give one kind of piece of advice to anyone like coming out, what would that be? This is kind of our last, like, just one sentence about some advice that you would give to students.
You know, last year I was, the co-chairs come to our board meetings on Fridays, or whenever we have our meetings. So last year we had, I forget her name, but she was always talking about the budget. And what was her name?
Brittany.
Yes. Yeah. And if you're in management and you're always looking at budgets, and she would just rattle off these numbers, and I was just like, oh my gosh, that was so nice. I think if you go into an agency and you just think of your most crucial asset to offer them. So, you know, the guy that said, I want your job. So I took it as, I can have this guy help me in certain administrative functions. So that was good to hear. Like I told Brittany, let people know that you have budgeting skills and that you've done this. Because when they hear that, their ears perk up. Like, oh, okay, so you do other things besides the clinical work. You know, I could use you in different areas. And that might get you that little bit of edge over. So it's just remembering something or knowing something that you have that is just that bit more of an edge.
I would say be open-minded. Leaving grad school, I didn't know which way to go, but I was very, okay, I'm clinical, I'm going to get my license in 2 years, and I was very on that mindset. But just be open-minded and take on different opportunities. Maybe your first job has, I'm families and children, more one-on-one, and I took on a lot of COPA projects, and which led me to get promoted. And just be open-minded, flexible. I think that will get you places.
I think I'd like to say maybe really emphasize on the social part of social work. So be as social as you can be in your workplace and outside of your workplace. Because, and I'm not saying go to happy hour every day, but what I'm saying is be open to mingle and cross work with other folks, because nobody works siloed. Like whether you're manager or line staff, whatever, you have to be able to partner up with people, collaborate. Sometimes you do more of the work, they do more of the work. I mean, just be more social about it, and then accepting about that. Sometimes you're just gonna, succeed. Sometimes you're gonna fail. But if you take the social angle and not emphasize so much on the work part, I think you'll go far.
Thank you all so much for coming. If you could give them a